Hello, my name is Aline Zargarian, and my research question is, why is there a link between physical disabilities and mental health? My topic is controversial because, one, when people hear about individuals suffering a physical disability, they tend to only see the physical injury rather than the psychological effects. Two, these individuals suffering these disabilities in the most severe cases are left codependent. So they need programs and policies designed specifically to their needs and priorities. Thirdly, mental health in general is a controversial topic depending on who you ask and what they believe. The importance of my research topic is to show the link between physical and mental health and to show that they go hand in hand. The two most common mental illnesses amongst the physically disabled community are depression and anxiety, with mental stressors being included because of environmental changes, financial changes, and loss of roles in personal relationships. Physical disabilities restrict the amount of physical activity an individual can perform, and this affects mental health because less dopamine and endorphins are released, which are related to feelings of happiness and relaxation. This can lead to things such as depression. Another way is higher levels of stress hormones such as adrenaline and cortisol are produced, which can lead to anxiety, feelings of worry, and insomnia. Lastly, memory falters because exercise promotes more blood flow to the brain, specifically the hippocampus, and through exercise, body produces a protein called caspin B, which is linked to improving the memory. In this presentation, I have provided 3 case studies as examples, but I will only be going over the first 2. The objective of the case study was to analyze anxiety and depression symptom severity related to physical activity. The method used to conduct this case study was first they sent out 3 surveys. T1 was the first one. A year later, they sent out survey T2. And 3 years later, they sent out survey T3. And each survey consisted of the Godin Leisure Time Exercise Questionnaire and the Patient Reported Outcomes Measurement System. I have provided a link to the Godin Leisure Time Exercise Questionnaire. And the Patient Reported Outcomes Measurement System was an item-bank measurement system evaluating depression and anxiety severity. The results, as you can see, showed that greater quantities of physical activity were associated with decreases in both depression and anxiety. This shows that affective disorders and symptoms, particularly depression and anxiety, are highly prevalent in individuals with physical disabilities. The objective of the second case study was how disability and bereavement in the elderly affects their mental health and well-being. But for the purposes of my presentation, we will focus on disability. They began by splitting up their participants into 3 groups as I have outlined in my presentation. They then asked the participants 2 questions to identify bereavement and disablement. Finally, they used the psychiatric epidemiology research interview, which I have given a link for. They used the Perry Demoralization Composite, which is a 26-item measure that assesses the constellation of feelings of anxiety and depression. They used the Perry Poor Self-Esteem Scale. Finally, they used the Mental Health Inventory, which I have provided an example of. And this is a 38-item measure of psychological distress and well-being. The results show that the disabled group had more psychological distress, higher levels of anxiety and depression, higher levels of suicidal ideation, and lower levels of self-esteem, which is consistent with the findings in case study 1. The results in case study 3 were consistent with the first 2 cases. The last example to provide evidence for my research question comes from the play The Glass Menagerie, and in specifics, the character Laura. After suffering from a childhood disease, Laura is left with a leg injury where one of her legs is shorter than the other. This results in her having to wear a leg brace. Laura's physical disabilities impact her mental health in life-altering ways. For example, she suffers from crippling social anxiety and shyness, which not only affect her self-confidence, but also inhibit her from doing everyday activities, such as going to school or even getting her driver's license. Thank you so much for listening to my presentation, and I hope that you were able to understand how one's physical state impacts their mental health.